First of all, the one thing that I think is the most lacking right now is is infrastructure, because this is primarily seen as an infrastructure bill, but it can be bricks and mortar, it could be social infrastructure. But a lot of the community health centers have said we need bricks and mortar infrastructure. We need to renovate our buildings. We need to expand our buildings. So what we're likely to do, and what I want to do, is to put in the instructions under the Energy and Commerce Committee about $10 billion over the next 5 years that would be used for actual infrastructure, bricks and mortar, if you will, for community health centers, all right? In addition to that, now that's where Marta is going to get mad at me. You heard me, Steve, hint over, she's going to throw the water at me next. I thought you were going to bless me with the water now. Okay, sorry. No, she's not.
The last time I heard, I'm not a nun, so I can't bless you.
Okay. Said it well. So in any case, Stephen, when we were going around, I want to spend a minute on this so everyone understands. I mean, you understand, but so as you mentioned, Sheila, each of the community health centers has doctors and residents present. Right here, it's with Rutgers. In Marta, it's with Rutgers also. But some of them are in association with other universities or medical schools, and they have their residents that come there. But it's not their residency program. It's the residency program of Rutgers or, whatever the hospital or health, is. What we did a few years ago in Congress is we set up a program where the community health center could have its own residency program. In other words, people would apply to become residents at the community health center, and they run the program. It's not the medical school or the hospital that runs the program. They run the program, and those residents don't count. These residencies cost a lot of money. In some cases, they've actually been sold by hospitals, right? But we don't want that. And if they, as you said it, Sheila, when you were talking about Newark and University Hospital, when the resident gets that residency program there, they tend to stay in the community. And so that's the main reason to do that, plus to create a lot more primary care residents who would actually stay at the community health center. Now, we've had this program for years, but New Jersey has never taken advantage of it, in part because a lot of the places are small and they were afraid of the commitment. So what we're doing what we hope to do in this reconciliation is have a program, expand that program, and provide funding over a long period of time. So like if Marta wanted to set this up, and she laughs because she knows that's how I wanted to do it, then they would have the funding for a period of time, so they wouldn't be afraid that she has to go out and raise it or take money from her existing community health center program. But it would provide doctors now who got trained as community health center residents, if you will. So I don't want to dwell on it, but I just wanted you to know that I'm up to this. This is like a big thing for me. So that's it. I want to now introduce Secretary Becerra. He's long been a champion of community health centers, expanding them, provide additional services, not only in urban areas like New Brunswick, but in rural areas and tribal areas. In California, they have a lot of very small Indian tribes, and they probably have suffered the most, not only from COVID, but also from, not having enough clinics and enough places and not having insurance and the whole thing. So he's just, let me just turn it over to you. I can't, there's so many wonderful things I could say about it. I'm going to stop there. Go ahead.
Congressman Pallone, Chairman Pallone, I want to say thank you for letting me come visit your district and be here in the great state of New Jersey. Lieutenant Governor Oliver, I want to say thank you to you and to the governor for all the work that you all have been doing to help implement for the people of New Jersey what we want to see at the federal level, and that is real action and real results. And so thank you for that. To everyone at the table, thank you. Obviously to the Chandler Health Center, Rutgers, to the medical school. Wow, thank you for making it possible to talk about all these achievements. Congressman Pallone made very sure that the President's American Rescue Plan got to the finish line. And as a result of that, I believe here in the state of New Jersey, you have about $130 million additional dollars to work with to deal with the effects of the pandemic. And I believe here in his district, I think, Frank, you made it possible to have some $13 million come to the 6th Congressional District as a result of the American Rescue Plan. what you did is not helping just your district and the state of New Jersey. It's helping every congressional district, every state in the country. And now what you are looking to do, working on the president's Build Back Better agenda, will be something I don't think we've seen in our lifetime. Maybe during LBJ, when we saw the creation of the Medicare and Medicaid system, we saw civil rights take to the forefront, and we passed the Civil and Voting Rights Acts. But I can't think of another time when in 1 year a president has been able to make such a big difference in the lives, and I mean letting people live, as President Biden might have a chance to do with the good work of Congressman Pallone and all of his colleagues. So I hope you and my former colleagues all have success. But what I wanted to principally do, and I'll stop with this, is simply say thank you to you as one of a network of some 1,400 community health clinics throughout the nation who are doing this. You are doing what other hospitals, other healthcare providers are doing, but you're doing something special. You're helping people like my parents, like my family, have access to health care. Because when I was growing up, it was tough for my folks to be able to afford good health care, certainly dental care. And what you do is phenomenal. Among that, the more than 14 million or so vaccine shots that community clinics have administered, 2/3 of them to communities of color. And we know how tough it is sometimes to reach some of our communities that are hardworking, but never have a chance to quite get the benefits of some of these things. So I simply want to say that you have been a lifeline to so many families in this country, and we not only appreciate what you do, but we hope that we can elevate what you do. And if we're successful working with Congressman Pallone and getting this Build Back Better agenda through the reconciliation package, the American Family Plan, the American Jobs Plan, wow. You all will be very happy, and I'll be very busy. And so I look forward to that. I thank you for taking the time to be with us, and I'll turn it back over to you, Congressman.
Thank you, Javier. And, I've been really kind of narrowly focused on community health centers. But as you know, this Build Back America plan and this reconciliation has numerous things. We expect to possibly make the Affordable Care Act subsidies permanent or at least long-term. We expect to expand Medicare to include dental, vision, and hearing coverage. We expect to do a lot more with home-based community services, and then there's other things like the child tax credit and home child care for families, and the list goes on. So many things that Sheila Oliver has championed over the years. I just was told that actually I should be calling you governor today instead of lieutenant governor, because the governor is not in the state. So I apologize for that. So we actually have Governor Sheila Oliver, fully responsible for signing bills and making all executive decisions while the governor's away. But maybe
we can create some mischief together for today.
I know. And that's for the next week at least, right? So, but look, in her own right, she has been such a champion over the years on so many healthcare issues. She knows community health centers up and down. So thank you for being here. Let's turn over the floor to you.
Oh, absolutely, and thank you, Congressman Pallone and Secretary Becerra. And I had to chuckle because don't think I get calls from senators about creating some mischief while the governor's out. But I want to thank all of you for the hard work that you do, and it's been wonderful for me to visit the Chandler Health Center. I pass this place all the time, and I'm sure many residents of the area pass this place all the time without really fully knowing what's going on. So I am a good person to refer people to our FQHCs. I do it all the time. And as I travel the length and breadth of the state and constituents tell us, their problems, I often point them to the FQHCs. And we're thankful, and Congressman Pallone has always delivered for the state of New Jersey. And, I kind of regard him as the dean of our New Jersey delegation. And, the
That means you're old.
I know,
it
but
doesn't.
I'm not the dean because Chris Smith has been around longer.
Really?
Yeah, but I'm the dean of the Democrats.
Democrats, yes. And, he has always prioritized what's important for all of us, and we love his leadership. And he was one of the first, I think, Congress people in this region to focus in on environmental issues and environmental justice issues. And you know that the governor totally embraces that agenda as well. Chandler has received $8 billion. All the FQHCs have received more than $8 billion in emergency funding based on this pandemic and what we've been going through. And we're grateful for that, and we're grateful for you seeing to that. I do want to make just a couple of comments about FQHCs, but I want to, in the absence of the governor, give an update on our COVID numbers today. So we received this morning from our Department of Health a report that we have 5,423,317 individuals who live, work, or study in New Jersey who have completed full vaccination. We encourage everyone in New Jersey every single day to get vaccinated, and it's the best way to fully protect everyone. As we engage in these debates about schools opening back up and children getting back into the educational program, we know that it's more important than ever to encourage people to go get their vaccinations. We're reporting 1,145 additional positive PCR tests today. And, that number keeps moving. And we have 271 presumed positive antigen tests today. Our positivity rate is currently 5.04. So you can see with each passing day, we're climbing up a little more. Our statewide transmission rate is 1.26. So our hospitals have about 782 COVID positive patients, along with 71 more who are awaiting, the results of their tests. We've got 157 people in our ICUs today, and 63 of them are on a ventilator. So throughout the day yesterday, 125 COVID positive patients were admitted to our hospitals, and 88 patients were discharged. Sadly, we're reporting 8 more COVID deaths today. And we try to keep up, Secretary, with this data on a daily basis because it drives what the governor's direction and policy direction will be. And Governor Murphy from the beginning said we will let the data and the science lead us where we're going in New Jersey. And, FQHCs, I'm a big fan. Always have been a big fan. I know most of the directors, across the state doing a phenomenal job. And the other thing you should know about the FQHCs, even though they independently are running their own operations, there is great camaraderie and interrelationship and collaboration with each other, which builds, a stronger network. And we know that in unity, their strength, and our FQHCs in New Jersey have demonstrated that through the years. We were among one of the first states where we got authorization to disperse the vaccine, and we're very grateful to you and to President Biden and to the whole team in Washington for, thinking about us. We want to make certain that our FQHCs continue to be positioned to serve and address COVID and COVID testing and vaccination for our underserved communities in New Jersey. And you've done a great job. I will always be a fan of FQHCs. I spent almost 16 years in the state legislature, and one of Frank's colleagues, Bonnie Watson Coleman, was a fighter in the state legislature for FQHCs, even so that when funding was lean, before we had the great team in D.C. that we have now, she even moved forth state legislation to supplement what the FQHCs were able to get. So
And Bonnie is
thank you for that.
Bonnie is the district just west. And she was also the majority leader.
Yes, she was a
of,
majority leader.
She was in the
Yes.
state
It's a
legislature.
tough cookie, too.
Yeah.
That's true too.
Thank you, Secretary.
Well, thank you so much, Sheila. Really appreciate it. Thank you for all that you've done. Now, my notes say, and again, it goes back to your time. My notes say that I'm supposed to ask Dr. Eric Jane and Dr. Roy Epps to speak, and then go around to everyone else. Is that okay with everyone? We'll do it that way.
Yep.
Okay.
Thank you.
Go ahead. And Dr. Eric Jane is Senior Associate Dean for Community Health.
Thank you. So my job is brief here today, and so we can get to the roundtable. Dr. Epps hasn't been able to get
Oh, he's
here.
not going to be here. Okay.
Unfortunately, our two board members weren't unable
Okay.
to join us. But from the staff of Chandler Health Center, Robert Wood Johnson Medical School, Rutgers as a whole, thank you, Secretary. Thank you, Congressman Pallone, and thank you, Governor Oliver, for all your support over the years, not just during the pandemic, but all your support. I want to acknowledge Sandra Hill, who's not here with us today. She's on vacation, but she is the Executive Director of Chandler Health Center and sends her best wishes as well. I came to Chandler in 1992, and I came as the medical director. At that time, Chandler had a patient population of a couple thousand people, and we were located in 2 double-wide trailers. And it's been my pleasure to watch this organization grow, not just in numbers, but in scope of practice. And its leadership has continued to impress me with the advocacy of our community board to seek to find better ways to take care of our underserved community. I think the pandemic for all community health centers laid bare the challenges that we have with our patient population. We were able to quickly pivot to telehealth. However, the connectivity with our patient base was a challenge. Many people don't have broadband access. They don't have the right equipment to really participate fully. Reflecting on what, Chandler continuing to grow, I appreciate everyone taking the tour, but we're physically just too small for our vision. And to your point about the need for infrastructure and build out, Chandler has no lack of need, no lack of vision, but we do lack space. And so I'll just put that plug in there. That's where we need to go as an organization. And I thank everyone for their few minutes of time.
Well, I mean, I appreciate that. And I do believe that the one thing that is most in need right now is the bricks and mortar. And that's why we want to do that as part of this bill, because I do think that's the one area that really has sort of been has lagged a little bit, in my opinion. So now we're opening it up. So you want to who wants
We
to?
just, without long, can we just have everyone just say their name real quickly
Sure,
and their
let's go.
affiliation? Because otherwise it seems kind of a little rude.
Yeah, I
Folks have
agree.
been sitting.
Sure, we'll start this way.
Vicente Gracias. I'm the professor of surgery from Robert Wood Johnson Medical School. I'm also the senior vice chancellor of clinical affairs at Rutgers and vice president of health affairs at Rutgers. So I've been the point person for the pandemic for the last year and a half.
Amen.
Clinically.
Amen. Thank you.
Thank you.
My name's Keith Lewis. I'm the chair of anesthesiology and perioperative medicine at Robert Wood Johnson Medical School, and also the interim executive vice dean, and very passionate about what happens at Chandler Health Center.
Thank you.
Jack?
Yeah. Jack O'Leary, CEO, Jewish Renaissance Medical Center, Perth Amboy, New Jersey.
Which is the health center in Perth Amboy. And Perth Amboy, you may be familiar with, is about, 85, 95% Latino.
Yeah.
That's the population. Go ahead. Marta?
You want to introduce me?
Marta Silverberg,
Better,
who I
don't
spend
want
more
to-
time with than
my
anyone.
Spanish accent is not that good, so.
She is the director of the Monmouth Family Health Center in my hometown of Long Branch.
Thank you. Thank
Dr. Pleasure. Pleasure.
Hi, I'm still Steve Levin from the tour. I'm a family physician and the medical director of Chandler Health Center.
Chris.
Good afternoon. Christopher Rinn. I'm the CEO of the VNA of Central Jersey's Community Health Centers with locations in Asbury Park, Keyport, Red Bank, and Freehold Borough. Thank you for having me.
Hi, Jeff Carson. I'm Distinguished Professor of Medicine and Provost at RBHS, Rutgers Biomedical Health Sciences. I'm a general internist. I do want to just call out, because we've all been talking about the pandemic and vaccinations, how this healthcare center was first on the block at getting vaccinations in people's arms, and they did an amazing job. They were one of the core facilities of this medical school and of this community, and we thank them so much for that.
Amen. Let's get that microphone. Yeah.
Well, good afternoon. I'm Bob Johnson. I'm the dean of both medical schools at Rutgers. So both the medical school here in New Brunswick and the school in Newark. And I'll see you again this afternoon. I'm a pediatrician. I've been practicing for just about 50 years, and mostly in Newark and in New York City. And this is probably the last chance I'm going to get to speak, but one of the things I want to say is, as a dean of a medical school, I've overseen for a number of years the growth of medical science. And medical science is just phenomenal. What we're able to do with major pandemics like COVID and like HIV. And so medicine has grown, but it's not grown for everybody in this country. And one of the things we need to do if we really are going to achieve health care for the total population is we have to have things like the FQHCs. And they need to be funded so well that they can provide the level of care here on George Street as they do in the hospitals. And I'm very, very pleased to see that the president's budget is going to do that. I'm saying it's great to be in New Jersey with a strong support for health care for everybody.
Absolutely. And I think you're about to hear from someone who's going to make sure we take seriously what you just said.
I'm Roshan Baptiste. I am a staff member here at Chandler Health Center. I am the quality improvement manager and also the risk manager and also the emergency preparedness person. So been like the lead person for COVID testing during this pandemic. And welcome to New Jersey, and thank you for coming.
Thank you.
Well, Javier, do you want to have some questions or comments, or you want to ask a question? Go ahead, tell them.
So I'd rather let folks have a chance to make some comments. Dean Johnson's comments right on the money, and I hope, Dean, that you'll test us at HHS, because if Congressman Pallone is successful, we're going to have more resources than we've had in a long time. And Hearst is going to be very busy trying to make sure that we get that out to the folks that need it most. And I've told my team at HHS, and the team's about 83,000 strong, that one of the pillars of at least my secretary term will be equity, and making sure that we get out there, and when we say we're going to give you good care, we mean you everywhere you might live, regardless of your zip code. So I hope you'll keep us to that and test us. So please, comments.
Well, let's go to the community health centers. I really would like to know what you think is the greatest need right now. Jack, we'll start with you.
Well, I'll go explain what I think the greatest need is by what we're doing, so everybody can get a flavor of what we're doing in Perth Amboy. Primary care facility, but we've now expanded into endocrinology, podiatry. We have a full radiology group moving into our building where we can offer more importantly, the mammograms that we find is a huge need in the city of Perth Amboy. We are almost in the ground with our first satellite in Carteret. So we think we need to expand the services within our area. It just can't be Perth Amboy. So we're looking into going into Carteret, on the border of Edison, down into Old Bridge as our next satellites, and bringing these very important disciplines to these other communities. We think that is the best way we as an FQHC can provide the services that are needed in these with the underserved population.
Which I think is a phenomena, as Chris mentioned, they have various locations too. And so this is the phenomena that we're seeing with these satellite, more outpatient, locations. It's true. Did you want to go, Marta, when, I don't know, maybe 10, 15 years ago when we started, you were even in the Congress then, I think, when we started expanding funding for community health centers, she started a separate dental clinic, renovated a building just for dentistry, then renovated another building just for women's services. So that's a phenomenon where in the same town of Long Branch, you started, a much bigger operation for dental and women's services, which is another thing that's been happening in other places too.
Right. We actually, our history is very quick, is that 17 years ago, Mammoth Medical Center had their outpatient clinics. We don't call it clinic anymore. And they decided to divest themselves from the outpatients, and that carried the residency, the primary care residencies in pediatrics, internal medicine, OBGYN, and dentistry. So when we became a federal qualified health center back in 2004, we acquire also the residency. When I said acquire, is that all the residents get their primary care experience at the health center, but also then we have developed a dual system whereby we have both doctors that only take care of patients, and then the doctors, preceptors that come from Mammoth Medical Center to teach the residents. And we have residents, students now at Rutgers. They are now affiliated with Rutgers Medical School, so therefore it's become Rutgers residents. And since we're talking about COVID, we started a little slow because always is the questions of money. Thank goodness through the rescue plan we have received plenty of money, and one of our goal actually, we do have a 40% of our patients are Hispanics, and they are anti-vaxxers. I don't know why. But it's misinformation, and but we have done, I think, very well with our patients. Vaccine, giving the vaccine, so that 70% of our Hispanic patients are vaccinated. Good. These are the patients that come to the health center, not necessarily in the community. So that we started now a plan working with the superintendent school to vaccinate children. We have the Pfizer, which you can use now for children 12 and above, so that we started a campaign. We're going to football games, not cheerleading, but actually vaccinating as many as adolescents, so that they're ready to come to school. Plus the fact that because the town is a very contained town in Long Branch, pretty much 60% of the population, they are outpatients, so that, and we are encouraging the vaccination now. We do it within the fabric of going to the doctor, so it's less of a burden, so that I think that, like everybody has said, we're no different than any other FQACs, because we have just one common mission, whether you're in New Jersey and California or any place in the country, we have the same mission, is to take care of the poor, disfranchised people in our areas.
But you should know, and not that it's significant, but to me it is, when she talks about the Hispanic population there, and this tends to be true throughout the state, maybe you know it, maybe you don't, it's a very diverse Hispanic population. I would say 50% are Portuguese speaking, which means, and mostly Brazilian, right? But some also from Portugal. But I mean, they are Mexican, they are Puerto Rican, they are Salvadorian.
Long Branch, mostly the population is Mexican and Central American.
Yeah, but you get the others, though.
Yeah, no.
You get the others.
That's a bold.
Yeah, she's talking about the people that come.
That means they're more recent arrivals there into the state.
Yes.
Yeah. So I saw you. You seem to be twitching or something. So why don't I go to you, Chris?
Go to it, Chris.
Yes, I'm the last community health center. Thank you, Chairman, for having me, Secretary, and for all of our colleagues here. We have great partnerships. Governor, thank you. No more important partnership than with the state of New Jersey. First, I'd be remiss, Chairman, if I didn't go back to just how important the funding. The core funding for health centers is, in the throes of the pandemic, we were figuring out how to get folks tested and get access to those who are in need. And we really didn't, we needed to know that the money was going to be there. We needed to understand that we didn't have to, kind of look over our shoulder when the shoe for funding was going to drop. And Chairman, I just want to thank you for your leadership, because having that funding really allowed us to look at emergency protective measures, allowed us to get to the business of protecting those in our community, launching testing, preparing for vaccinations, and also protecting our workforce. So that allowed us the focus, the operational focus that was critical in the pandemic. And so thank you for that. The $7.6 billion you mentioned earlier in the American Rescue Plan, we are hard at work at the VNA CJ Community Health Center already looking to expand. Just like our colleagues in Jewish Renaissance and in Monmouth Family, we have a number of initiatives. We are expanding our Red Bank location, doubling the size of it in terms of exam rooms, adding services, including, and we spoke earlier about the importance of dental. We don't have dental services right now in Red Bank, but we're adding dental services there. In fact, we have 4 sites. We have dental in 2 of those sites. And as a result of this funding, we are going to move ahead and put dental in all of our locations. And we're not thinking about it or planning for it, we're actually doing it. Architectural plans are in the work, they're almost finalized. We'll be, I wish the commissioner was here because we'll be submitting our applications to the Department of Health. So this is the money, this is really where the rubber meets the road. We're putting it into action so that we can better serve our communities. And they need that type of care, especially in the midst of a pandemic.
But I want to say, if I don't interrupt, but I just want you to know, it was December, I guess, of last year when we first started to get, mass vaccination, or maybe January. Or am I going back? It's got to go 2 years.
Right, no, this
right?
last year, you're right.
And Chris, within days, I think it was in December or January, started to do the mobile clinics where he was going out in the various communities, not just at the health center, but at other locations too. So I just wanted to mention that too.
Yeah. And we're redoubling, obviously, with the recent surge, the concerns about the Delta variant, we are redoubling our efforts, getting into communities that are hard to reach, not giving up. This is an effort that doesn't really have a finish line in sight. We have to keep at it. We have to dispel the rumors. We have to partner with our faith-based organizations, our other community organizations, and get the word out.
Sheila, you mentioned the ministers, and he did that almost immediately, was reaching out to the various churches and synagogues. And I say synagogues because within the Jewish community, there still is a lot of resistance, particularly with the Orthodox, as you know. So, he made it his business to go out there.
No, thank you. And looking at hopefully the $10 billion in the lift, I mean that will be a game changer, not just for FQHCs in New Jersey, but all across the country, and enable us not just to expand, but to put services and put sites into areas where they're most needed. Many of our patients don't have the luxury of an automobile. Many of our patients are single with multiple children, and they need access to where they can walk. And so I'm hopeful that the Lift America Act and the $10 billion associated is passed, and that we get to invest in the infrastructure that our communities so desperately need. So,
one person that I'm relying on, you probably know this, but if we don't have this $10 billion for the Community Health Center, he'll be beating everybody up, including the president, and that's Jim Clyburn.
Oh yeah.
Right? He's gonna, if I don't put that $10 billion in there, he'll have Cedric Richmond over there. He'll be beating up Biden and Harris every day. So,
I'll be giving him the club to beat everybody up.
And lastly, Chairman, if I may, your leadership on the DOC Act and ensuring that we get to permanently authorize and expand the graduate medical education program. We need doctors. We need good doctors. Yeah. We need to train doctors in a community health setting. They are the pillar, the foundation, the cornerstone of the work that we do. So,
again, if you have to go, tell us. And I know Jack has hand up, but Marta and you, I've talked to you both about this. The program exists, but the problem is that you're worried about short-term funding, right? In other words, if we don't have long-term funding, you can't make that commitment, right?
Yeah, and truthfully, we have a great partnership with Rutgers on many levels, but this certainly would provide an opportunity for us to reinvest in other sites, in other areas that bring family medicine physicians into our communities, doing the work that they so are desperately needed to do. So,
See, in our state, Javier, and I think it's true in a lot of states, the community health centers are relatively small. So for them to set up their own residency program, they have to know that the money's going to be there over a period of time. Otherwise, they can't afford to do it. You know, that they're going to be setting up something that doesn't exist because they run out of money in a few years.
Well, I don't know it necessarily, Congressman. I don't mean to, because it touches well on education, since we're all educators here. I don't know if you necessarily want to piecemeal it through each of the FQHCs. We've been doing an enormous amount of work over the last 5 years in New Jersey of consolidating GME over certain areas like Rutgers Health, which is a sponsoring institution here. We can deploy the workforce in a much more appropriate way that effectively educates the residents as well as provide the service. The issue with a model where you don't have both the university and the FQHCs working together, it's the same thing that happened 30, 20 years ago with health systems. They become service-oriented and they lose the education part. The background for community-centered care is in teaching the students, the residents, a new respect and a newfound way of taking care of the community. That's what the pandemic has opened up. How we're able to fund GME across New Jersey, I don't know if it's necessarily individual as much as support the concerted effort that we all have that's really grown over the last few years here.
No, I agree, but the problem is the way it's set up, if you don't have it done by the community health center, you don't get the residency slots free. You follow what I'm saying? In other words, these are new residency slots that are associated with the community health center, and you don't have to pay for them.
it'd be very helpful to us, Chairman. And I would be remiss, Secretary, if I didn't also recognize your leadership for the continuous support of a vital program to FQHCs, and most importantly, a program important to the community members that we serve, the 340B drug program. Holding the pharmaceuticals accountable and making sure that they're not siphoning off funding, and making sure that the program is intact and available for those who need it is critical. And I appreciate and thank your leadership on behalf of my colleagues. Getting folks the medicine that they need is an important initiative.
I know how critical that is to the clinics, and I know we're getting the
Jack, I
signs.
think you're going to be the last one.
Jack,
and
it
then
has
we
to
gotta
be real
go.
quick.
Very quick. I just wanted to put a plug in for oral health. We do over 2,000 visits a month in Perth Amboy. And I think it's important that all the FQHCs have a big and large and robust dental program, because it's needed.
Amen.
Absolutely.
Amen. Sean, are we? What's the?
Take a couple questions from press, and then we're out. So
Okay.
I think we'll go to Michael with the Asbury Press.
And Michael, you may have to shout it out.
I have to turn people away.
Secretary, you've heard with this discussion, what were some of the lessons you take away from COVID in terms of the health of the American healthcare system? We spent a lot of money, we've had serious devastation from the disease. What needs to be done to where are the holes?
So first observation, just about everywhere I go and when I visit these community health centers, I see the same thing. You see people working really hard, you hear a lot of babies crying, and you find that they are doing the work that would not be done were they not here. And so we applaud what these community health centers have done. When it's not just on COVID, it's on everything. These are the places that give vaccinations all the time, not just during a pandemic on COVID. And so we thank them for that. Secondly, I think what we found is that there is a pretty clear a prescription for getting results on COVID, on vaccination, and it's reaching people where they are. And that's what these community centers, health centers, do better than anyone else. They go where the people are who need the care. And to the point of those who are stressing how important it is for them to be able to expand, whether rural areas, whether urban areas that have pockets of hardworking people who are still below the average income scale, we need to go to them. And the other thing that I take from this, because I think it was Dr. Levin, was when we were talking about the work that they've done in vaccinating thousands of people in this area, it's that oftentimes they have to go to where these folks are and talk to them, because oftentimes if they haven't gotten vaccinated, it's because they can't take time off from work, or they're afraid they're going to miss work if they get vaccinated. And that's where we need to hear the voices of those who are on the front lines, because the reason President Biden proposed that we offer employers a tax credit, a tax break, if they allow their employees to go get a shot, and if perhaps they have some symptoms, they get to stay home and not lose pay, is because we heard folks say a lot of workers can't afford to miss a day of work. And a lot of employers can't afford to pay their workers if they have to miss a day of work. And so here's where we stepped up. And the final thing I'll say is it's becoming really, really evident to me. It is really resonating every time I visit one of these community health centers, how crucial it was to pass the American Rescue Plan, how indispensable it was with Congressman Pallone as the chair of the committee that deals with health care in the House, was to advocate and get it done, because that 13 million or so that Congressman Pallone got to bring into his congressional district, the 130 million that he was able to bring into the state of New Jersey, it's doing exactly what we just talked about. I imagine that everyone, including Lieutenant Governor Oliver, will be saying, we don't have as much money as we need to do this work. Thank God the American Rescue Plan brought in some resources. And right now is not the time to count pennies. It's not a time to not provide people with the care they need, because that pandemic will spread, as we're seeing with the Delta variant, as quickly as you can say get up. And so we have to be on top of it, and that's where I think the community health centers have been perhaps the best on the front lines in making sure we're reaching people who deserve to have that care.
We've got time for one more.
Brent Johnson from the Star-Ledger of Newark. Is it time for states like the federal government did to require all government workers to be vaccinated?
It is certainly time for all of us to act responsibly. And I believe the Lieutenant Governor, the Chairman of the Energy and Commerce Committee, Congressman Pallone, and others here would say, we all have a responsibility. If we're in public service, we have an even higher responsibility. Not just to ourselves, it's a personal responsibility, but we have a personal responsibility to the people we represent to do what's right. And it's not just to do what's right what we think politically, it's to do what's right based on the science and the facts. Today, and Lieutenant Governor, I don't know if we know of the 8 people who you say died yesterday of COVID in New Jersey, if we know if those 8, of any of those 8 were vaccinated, but I'd be willing to bet you that they were not. Do we know?
You're absolutely right. And if Commissioner Persicelli were here, she would tell you that the deaths we have experienced in the past 90 days are people who have not been vaccinated.
So when more than 99% of the people who are dying today of COVID are people who are unvaccinated, I think we understand we have a responsibility to make the vaccine as available as possible. And if you are a public servant and you are getting in the way, that is not doing well by the people you represent. And it's certainly, from my perspective, not taking personal responsibility for your obligations, not just as a human being and a fellow citizen, but as an elected or an appointed representative in government. And so we all have a responsibility. The federal government, President Biden has made it very clear, where we have the power to require something, we do. The reason when I came out of the airport today, I was wearing a mask, is because President Biden has said it. Anyone at airports, in places of public transportation across states, you must wear a mask. I just recently instructed the personnel I have who do direct health care within HHS to now wear masks. And we have several thousand of our employees who are in direct line of health service, and now they will be required to wear masks. We hope that our governors and our local leaders will take on their personal responsibility to make sure that we're all safe, because at the end of the day, if you don't take care of yourself, you may be infecting one of your fellow Americans, including the millions of children who are under the age of 12 who cannot yet be vaccinated, and through no fault of their own, they should not be suffering the possibility of death because someone was not personally responsible.
Well, thank you, Javier. Thank you, Secretary, really, for coming here to New Brunswick, and not only the roundtable, but the rally we had before on negotiated prices. Thank you, Governor. I'll repeat again, Governor Oliver. And let me thank Chandler for putting this together and providing the tent and everything that you did today to make this possible. and all of you really for being here. Thanks again. Thank you.
Thank you.
All right.